हेलो, मैं डॉक्टर रोशन दीक्षित हूँ। आई एम द सीनियर कंसल्टेंट हेमेटोलॉजिस्ट एंड बोन मैरो ट्रांसप्लांट फिजिशियन in Aakash Healthcare Super Speciality Hospital, Dwarka, New Delhi. Today we'll discuss about bone marrow transplant and its uses in clinical treatment. So bone marrow transplant is a procedure which is usually offered during the treatment of some malignant and non-malignant condition. यानी कि कैंसर या नॉन कैंसरस सिचुएशंस में कभी कभी हेमेटोलॉजिस्ट आपको बोन मैरो ट्रांसप्लांट सजेस्ट कर सकते हैं. So the usual indications of bone marrow transplant can range from a series of malignant and non-malignant conditions. The common malignant conditions यानी common cancers जिनमें हम bone marrow transplant suggest करते हैं, those are leukemias यानी acute myeloid leukemia या acute lymphoblastic leukemia, कुछ lymphomas जैसे non-Hodgkin's lymphoma या Hodgkin's lymphoma, certain non-malignant conditions like aplastic anemia, and in children there are certain inherited conditions like congenital aplastic anemias, and sometimes in hemoglobinopathies like thalassemias and sickle cell anemias. So the use of bone marrow transplant is usually to replace diseased bone marrow with healthier bone marrow from an individual. So usually the bone marrow is got from a donor, but there are certain situations in which we also perform an autologous bone marrow transplant जिनमें हमको donor की ज़रूरत नहीं पड़ती है. The most common indication for an autologous bone marrow transplant जिनमें donor की ज़रूरत नहीं पड़ती है will be multiple myeloma and lymphomas. एंड एलोजेनिक ट्रांसप्लांट्स यानी इसमें डोनर की ज़रूरत पड़ती है. यूजुअली हम पेशेंट्स का HLA सिस्टम देखकर उनसे मैचिंग करवाते हैं, एंड द बेस्ट पॉसिबल HLA मैच इज़ यूजुअली फ्रॉम अ सिबलिंग and sometimes from the parents. So after HLA matching is done, the patient is given high dose chemotherapy to eliminate the diseased marrow, after which the patient is given the healthy bone marrow from the donor. बोन मैरो ट्रांसप्लांट का जो प्रोसीजर होता है दैट इज परफॉर्म्ड बाय स्पेशलाइज्ड डॉक्टर्स इन अ स्पेशलाइज्ड यूनिट. इट डज नॉट इन्वॉल्व एनी मेजर सर्जरी. इट डज नॉट कॉज एनी पेन ड्यूरिंग द प्रोसीजर. It is done in a inpatient यानी admitted sitting in which the patient is admitted to the transplant unit for around 4 to 5 weeks, during which the patient is monitored for side effects of chemotherapy and is given supportive care to manage the side effects of transplant. Transplant के बाद patient regular follow-up में रहते हैं to look for any side effects or complications of the transplant, and usually patients come to the clinics in the OPD and are managed in the daycare in case of any problems. So bone marrow transplant is usually a curative option in multiple cancers, and it sometimes is essential to manage the disease, and especially in children with inherited globinopathies like thalassemia, sickle cell anemia, जिनमें thalassemia is the only curative option currently available. So in case of any queries regarding bone marrow transplant, hematological cancers or hematological disorders, please don't hesitate to contact us at Aakash Healthcare Super Speciality Hospital. We are equipped with all possible treatment modalities for management of your health problems. Thank you very much.